Hey everyone, welcome back. It is Vanessa, psychotherapist, coming in to share an article with you all as I am doing some research, and I wanted to follow up on some information that I shared in my last video, which I spoke a bit about safety as it relates to the use of GLP-1 medications and the underrepresentation of Black women in these clinical trials, which I was excited to find this article. I am being challenged with finding research that represents Black women and also other people of color. Of course, I am a researcher as well as a practitioner, and so for me, data matters, but what is happening to the people matters more. So if I didn't have this information to look at and bring in and to share with you all, I could not encourage you to do your due diligence to go and read this information. I'll dive right on in because I think this is an important fact and piece of data and work that we should be considering as Black women or individuals who identify as Black or African American, to understand how GLP-1 medications were trialed and the populations who have been a part of these trials and those who have been excluded. So this article came from the NIH. This is one of the platforms that I find to be reputable. I say that, and then I also encourage those of you who will be doing your own research to make sure they are reputable sources. There are a lot of flaws, there are a lot of faulty information that is out there, and it could be to the detriment of you. So I like to share, make sure that you are getting your information from reputable sources and that you feel comfortable with the information that you are being provided. So the National Library of Medicine is a very reputable source, and I am pulling from this as I am sharing with you all because I'm not a medical doctor, but I've worked in many of hospitals and know doctors and nurses and dietitians and can tell you they are humans just like you and me. And so that being said, the information that's being provided to medical professionals is not just information for them to gatekeep. I pride myself in being a therapist who also teaches my clients. So I don't just go off of what I say. I always show my clients the data and the information, and then we have real conversations around it. I am not a medical doctor. However, I am a psychotherapist and a researcher, and I understand the research. And getting my doctoral degree, this is something that I just have to understand in order to be able to work with people and really understand their experiences, not just from a practitioner standpoint, but also from a scholarly standpoint, where I need to understand the data that's being provided. So that being shared, I want to bring this all to you so that we can start to talk about this. I found this article on Semaglutide or Semaglutide, however you want to pronounce it. I thought that it would be helpful to bring this article in and provide this information so that we can also get a fair comparison of, let's say, Zepbounds and Wegovy or Semaglutide and or Tirzepatide. This information is very brief, but I wanted to get into it. And I'm looking over here because I'm scrolling. So you all are seeing my shared screen. So I am looking over here to read it because I can't really see it on this screen. The one thing I love about these types of publications is that you have an abstract which gives you like a brief overview of the objectives, so you don't have to go through the entire study or published document, but it gives you a breakdown of the objective, and that is just letting us know what the study was for. So in this case, it is on the efficacy and safety of semaglutide or Semaglutide 2.4, which is different than Zepbound or Tirzepatide, which is 2.5 milligrams. And they did this as it relates to race and ethnicity. This was randomized controlled trials. So the thing about randomized controlled trials is that they are not picking, right? So it's just random. So keep that in mind. In the abstract, what we have here is the objective that talks about the study and how it was to evaluate the efficacy and safety of semaglutide 2.4 milligrams, it being a glucagon-like peptide 1 receptor agonist. Most of us are aware of that now, by race and ethnicity across 3 phase 3 trials. So this is just providing us information as it relates to what the trial looked like. And the methods were that the semaglutide treatment effect in people with obesity, the STEP is what they call it, so they have the acronym there. But so the semaglutide treatment effect in people with obesity, clinical trials evaluated the efficacy and safety of once weekly subcutaneous semaglutide 2.4 milligrams. So here, step 1 and 3 data were pulled from analyst step 2 data, which that can get confusing, but that's okay. Read it a couple of times. It may make sense, but we really want to get to the next part. So all analysts were conducted using data from racial and ethnic subgroups. So the primary outcome was the estimated treatment difference in percent body weight change for semaglutide 2.4 versus the placebo. So that's just giving us information on the methods and how they, just the subgroups, the methods that they used in order to reach their determinations. The results were, and that this is where I really want to focus. The results were that participants reported their race as white, and we're looking at 75.3% for step 1. And for step 2, 59.4%. Blacks were at 8.8% or 8.9%, which this is very similar to what I had mentioned in the previous video as it relates to Tirzepatide. So this is very similar, which is a very low number of blacks being represented in this trial. So there's no difference between semaglutide or Tirzepatide, which I found to be interesting, that both of these trials found, so Tirzepatide and semaglutide Wegovy, both chose to include 8% of black folks. So that is a very low number. And as you can see, it is the lowest number of all of the people except for other racial groups. So we don't know exactly who the other racial groups are, but they just lump sum these individuals in there at 5.3. Going back a little bit, so for blacks, 8.8 to 8.9%, and I'm taking it that is for step 1 and 3, that there was 8.8, and then for step 2, there was 8.9, a point increase. And I don't know how that actually happens. I'm laughing, but it's not funny because this goes to show the seriousness of it. And not that we should not include ourselves in the use of GLP-1 medications, not that we should exclude ourselves from the benefits of this medication, but we should be informed and aware of this, knowing who is inviting you into the room to experience the benefits of a medication which could promote health on a number of levels, promoting health versus not giving a damn about a particular population or group of people and saying we could care less we are going to focus on this group. For Asians, it was not that much higher for step 1, which is the first phase, at 10.6%, and then for step 2, or 1 and 3, for 10.6%, and then step 3 for 27.3%. So more than doubled in the second step, which is interesting. And then for the other racial groups, going back to that, the first and third step, there was 5.3%. And then for the second group, it was interesting that it decreased to 4.4. However, that could be some people drop out of clinical trials for a number of reasons, life events, also maybe some side effects that they are not able to tolerate. And then people have the right to drop out if they want. Then for the Hispanic or Latino population, the numbers were pretty low here for semaglutide, and that was 13.9 for the step 1 and 3, and then 11.9 for step 2. Again, that number went down, which was interesting. However, I still am finding this interesting. Both groups, or both clinical trials, whether it was for semaglutide or for Tirzepatide, only chose to include 8% African Americans or blacks into their clinical trials. This is what I am studying and researching, so that when I come in and do these videos, you know that one, not just coming off of the information I'm being provided by the women that I work with. However, that is a big part of it, because this is a small part of it. The real life experiences are the most important, but this is important as well. So this is the information that I am bringing to a lot of the videos that I do and will be doing. And this is the information that is helping me to write my published article, so that I can inform on a greater level as it relates to Black women in the use of GLP-1 medications. And if you look up here, this is important as well. So looking at this date, this was written in 2024. So this was just written a year ago in July. So this gives you an idea of, one, the challenge that I'm having in terms of finding information to be able to provide and to write on. So for me, a lot of it is going to be self-reporting from the women that I work with, to get the Black woman's voice as it relates to their experiences with using a GLP-1 medication as a tool to help them get to their healthiest selves. So I will be back in with more information, and I know that data can be a little boring. For me, it's exciting, especially if it's something I'm passionate about, but I encourage you all to think about the data, because it will tell not only the story of the individuals who are being represented at higher numbers, but it is going to tell the story of individuals who are not being represented, and then what we need to do next. So again, I talked about our younger girls who will be coming up, because the disease of obesity is probably not going to go anywhere anytime soon, and GLP-1s are changing what that looks like. I will say this too. As you notice, some of the insurances are no longer paying for these medications. And when I think about Medicaid no longer paying for these medications, I won't say that it is 100% a opting out in order to keep Black people or marginalized individuals in a position where their health does not improve. That a huge part of that is also the fact that these medications are hella expensive. And so then now we're looking at the issue of affordability along with efficacy and safety. All right, this is me coming in just educating and also bringing you all the information that I am studying, and also bringing this to the table so that we can converse about and become more aware. It is my hope that I spread awareness around this topic so that we can begin to look at this and, yeah, make some changes. Okay. All right. Thank you so much for watching. I will see you all in the next video. All right. Take care.